The motive for cosmetic surgery is what I was talking about. I never had the motive to escape my identity. It's true, I wanted to reduce the size of my lower lip, and I also wanted to have a more slanted forehead, and I also wanted to have a more projecting mid-facial region. And I hadn't really had a look at my jaw being too small from the side view, but that would also have been something else I would have wanted, except for the fact that it would be very strange to do that. The motive, I never had the motive to make myself unrecognizable so as to escape my identity, because I thought it was a fairly fortunate upbringing that I came from. I was not aware of many unfortunate events in my past. So it's the motive that I'm talking about. The motive for cosmetic surgery. I never wanted to escape my identity through cosmetic surgery. You see, that's the distinction that I'm talking about. Now, if you added all those different modifications up, it's only because I thought I was too ugly and too weak, and a combination of weak and ugly, not respected enough by the first impression on the first look at me, not respected enough by the people's first impression of how I look. And that's a combination of thinking, I look too weak and I look too ugly. But that's a different motive versus I want to escape into a new identity to become unrecognizable. That was never my motive. The only thing I thought about when thinking of disguises, temporary disguises, that was about, could I get away with something such as, what if I was going to rob a bank, or what if I was going to go and, get revenge on somebody, someone I hate, such as Samuel, or the powerful men who are always supporting Samuel, my mother's older son from a different father. So if I could get away with something like wearing a disguise that was just enough to conceal my identity, but that's temporary. I never wanted to have a permanent escape from my identity. You see, I was never one of those people who said who wanted to fake their own death and escape into a new second life in seclusion, because I always thought I had a good origin story, that I'm the son of Stephen Gaskin. He's this sort of a frustrated hippie and a little bit eccentric, and overall I come from a conservative father and a conservative community, and we are just conservative people, because I didn't have any memories from before the age of 10, more or less, none. A few small memories that didn't inform me of a whole lot of things. So anyway, no, I never did consider trying to escape my identity, and I still don't think of it. So that's what the difference is. Your motive for cosmetic surgery: are you thinking that you're too ugly, or are you too weak, or do you like the way you look, or do you think that you just want to look like another person to an escape to a new life? That's a different motive, and that's a motive I've never had. So, I overlooked that I wanted to have a more sloped forehead, and I wanted to have a more prominent mid-facial region and a smaller lower lip, and I wanted to see if I could get my upper lip to be more proportional, and it didn't help at all. The only thing that made a difference was actually pressurizing my sinuses to do enhanced, what I'd call enhanced pranayama, enhanced nasal breathing, where you do the nasal breathing to calm yourself after you do the pressurizing of the sinuses. And that may or may not be equivalent to a disguise if you factor in cold weather making your nose shrink up even more than it would be otherwise. And also fatigue. Fatigue making your facial features, your eyes sinking in, and your nose shrinking in, and pulling, like an old person who's dying. Their upper lip is getting pulled up on their teeth from fatigue, and it's like their face is getting pulled into a little bit. It's being pulled into their nasal passage as the flesh of the face is shrinking from fatigue and cold exposure to cold weather, and also things like smoking or snorting cocaine, eating out the flesh, destroying the flesh through cocaine, or tobacco juice destroying the flesh in your mouth, things like that, or inhaling cigarette smoke, destroying the flesh inside your nasal passage, and sinking in of the eye sockets. These are things that you'll see more teeth on a man who's getting closer to death, because his upper lip is kind of going in as the flesh is going into his nasal passage. It's the flesh is withdrawing from a hostile environment. Plus, he hasn't got enough circulation, and his blood pressure is falling gradually as he ages. Inversion, you see, I do the inversion, which enhances blood pressure, and that helps to anyway, so it makes my face plump up more. And so if I live in a warmer climate and I keep doing inversion, that's it's not all just the effect of enhanced breathing through the nasal passages by pressurizing the sinuses before breathing, although that helps. But there's another factor, the social factor, withering of the face, which is being in a hostile social climate. So enhancing your confidence is one thing to prevent your face from too much atrophy, where you stop making expressions at all because nobody wants to see the facial expressions and hear the words that you say, or see the facial expressions you make, and your face is atrophying from severe social isolation and social hostility. So those are multiple factors. Of course, my face is too small to begin with, and you can see it on the side view. My teeth are somewhat close to my eyes. My jaw is too small, but the more you look from the side, you see that I have a disproportionately small face. So anyway, that's the fact on my thoughts on cosmetic surgery for myself was not to escape my identity, and that's a different motive. I'm too ugly and too weak looking. That's a different motive versus saying I want to escape, to be unrecognized so that nobody knows who I am. I never had that motive. So don't try to score points on that one, because I never had that motive. And I've never considered faking my own death like like Abraham Lincoln. All right, that's all for now.